सगळ्यात पहिल्यांदा मी माझी ओळख करून देतो. मी तुषार पोखरे, राहणार ओरळगाव, तालुका शिरूर, जिल्हा पुणे येथील ग्रामीण भागातील मी मुलगा आहे. एका शेतकऱ्याचा मुलगा. एक काळ असा होऊन गेला की 2014 मध्ये मला फेब्रुवारीमध्ये एका अपघातात म्हणजे फटाक्याने मला वाचलं होतं. माझं म्हणजे अति दुर्दैव झालं, परंतु त्या काळातून मी वाचलो म्हणजे मला वाचवलं. म्हणजे दवाखान्यात गेलो मी. त्यानंतर दवाखान्यात सरांनी माझी म्हणजे जगल म्हणून गॅरंटी दिली नव्हती, परंतु देवाच्या नशिबाने म्हणजे माझ्या आणि देवाने मला वाचवले. त्यामुळे मी देवाचा आभार मानतो. आणि त्यात मध्ये मला की समवेदनाने मला खूप मदत केली. म्हणजे त्यांनी मला खर्चाबाबत कधी माघार घेतली नाही. नाहीतर माझ्या वडिलांची परिस्थिती अतिशय वाईट होती. कदाचित त्यांना माझ्यामुळं संपूर्ण जमीन गमावावी लागली असती, परंतु समवेदनाने मला मदत केल्यामुळं अतिशय चांगली गोष्ट झाली. आणि मी त्यांचे उपकार कधी विसरू शकत नाही. कारण आयुष्यात मला म्हणजे पुढे नेण्याचं काम केलं तर त्यांनीच केलं. आणि सर्वात प्रथम म्हणजे दामले मॅडम, त्यांनी मला खूप सहकार्य केलं. त्यानंतर त्यांनी मला म्हणजे असं सहकार्य केल्यानंतर मला दवाखान्यातून बरा झाल्यानंतर मी घरी गेलो. घरानंतर पूर्ण बरा झाल्यानंतर मग येण्या जाण्याची वेळ चालू झाली. म्हणजे मॅडमने मला विचारलं. त्या पिरियडमध्ये मी 10वी SSC परीक्षा पास झालो मार्च 2014 मध्ये. त्यात मला म्हणजे 73.40% पडले. त्यांनी माझे अभिनंदन केले आणि पुढे शिकण्याचे विचारलं. तर त्यांना मी सांगितलं की मी BSc करून मला बायोटेक्नॉलॉजी पदवी घ्यायची. त्यानंतर मी जॉब वगैरे करून माझ्या पद्धतीने शिकू शकतो.
Samavedana, compassion and empathy towards underprivileged needy and the action to see them through the critical situation.
In 2003, looking at the miserable condition of poor patients, Dr. Charudata Apte, some of our colleagues, and I decided to start this activity of giving financial aid to poor patients called Samavedana.
The organization works on the basic principle of bridging the gap between the needy and the healthcare. Any illness comes with a handful of worries in the families living in rural areas and urban slums. In spite of their striving to deal with the financial burden coming with the illness, there is no assurance to the patient of coming back to his normal life. Samavedana lends a prompt helping hand to these financially weak patients in complicated surgeries and treatment, taking their responsibility till the end of the treatment. Patient pays up to par to their capacity and the remainder is taken care by Samavedana.
ये हमारा बच्चा कार की गैस की वजह से इसको थोड़ा एक्सीडेंट हो गया था. इसके लिए हम लोग सूर्य हॉस्पिटल में गए थे. तो सूर्य हॉस्पिटल में हमारा खर्चा ज़्यादा होने लगा. तो फिर हम लोग को वहाँ के हॉस्पिटल ने ये संवेदना के बारे में बताए. फिर हम लोग उनके पास गए और उन लोगों ने हमारी मदद की. तो फिर हमारा बच्चा अच्छा हो गया, अभी ज़रा ठीक है. इसके लिए हम संवेदना के और हॉस्पिटल के बड़े शुक्रगुजार हैं.
Our specialized doctors and surgeons treat these medically and socio-economically eligible patients free of cost. Sahyadri Hospitals, a well-equipped chain of hospitals in India, does its bit by subsidizing the services. Samavedana is also a public health platform spreading awareness and educating people about preventive medical care. We organize various health talks and free checkups for women in the remote villages and urban slums. The need for intervention felt through this journey gave rise to the new programs of cancer prevention for women and awareness of organ donation. With the genuine efforts of all our doctors, surgeons and volunteers, Samavedana has come a long way. We could make difference to many lives only because of the generous donations and support from our thoughtful donors.
We are working with Samavedana in our individual capacity as well as a part of my corporation. I think when we are looking at a country like India and when we want to really help the citizens of our own country, we were looking for an authentic platform where we can do the donations, but the platform can make those donations really reach to the patients in its full meaning.
I think the best thing which I like about Samavedana is their transparent policy, which which is very trustworthy. They make us understand what is happening on the case-to-case basis about whatever donations we are giving for that particular patient. We can get a complete insight about the kind of therapies or the treatment which is being given to patient using our funds. So, and I think that's the most comforting kind of a scenario for all of us, and I would definitely recommend Samavedana to all of you and try to contribute in their noble efforts as much as possible.
Samavedana has spread its wings by introducing various outreach programs like mobile mammography and community clinic, but this journey does not end here. We have to still reach out to many more needy in pain.
Today, Samavedana is reaching to 3,500 persons approximately. This would not have been possible without support of all donors and well-wishers. It's a moment of immense pleasure for our team when a patient goes home walking on his feet, recovered out of his illness. I request you all to come forth and join us in this endeavor of bringing healthcare to all those deprived.
You can be a part of Samavedana family which feels together and heals together. So join us in this noble cause of lighting up many lives with the lamps of healthcare.